That's periosteum. Periosteum is the bone, okay, your skull bone. Underneath it, you have dura mater. And then you have arachnoid matter. Then you have that's your pia mater. Inside the pia mater, you have the brain. Okay, that's your brain tissue, folks. Those are brain tissue. Your brain parenchyma. Okay. So the pia mater is literally attached to your brain. It's impossible to separate even during autopsies or dissection, folks. Now, the space above dura mater, this area is called epidural space. Okay. This is epidural space. Why? Epi mean above. Above dura mater is epidural space. Below dura mater, subdural space. Subdural space. And below arachnoid matter, subarachnoid space. In subarachnoid space, these dots are your CSF, folks, okay? So your CSF fluid is there. In epidural space, you have artery. These are meningeal arteries. Subdural space, we have veins. Subarachnoid space has again arteries. What arteries? Cerebral arteries. Your circle of Willis and all those things are floating in CSF, okay? Anybody has any questions so far? So epidural space has meningeal artery. Subdural space has veins. The good thing about veins, there is no specific name. We just call bridging veins. And then subarachnoid space full of CSF, and you have a cerebral artery that's floating. Okay, that's your circle of Willis. Now, did you see epidural space? I put a wall. These are compartmentized. It's important. They are compartmentized, folks, okay? So this is one compartment. There's a falx in between, like a wall that separates it. Any questions so far? All right. Now let's touch a little bit here. Anytime you rupture a blood vessel in the epidural space, okay? Anytime you rupture a blood vessel, let's say here, the blood vessel ruptured. When the blood vessel ruptured, they cannot go up or on the side because these are strong walls. The only place they can go is actually downwards, folks. So what they do, they push the dura mater like this, okay? So they push it, so the blood will go down like that. Is that clear, folks? Now you are creating almost a lens shape. You see that, folks? Compare that shape with this. You see that shape? So when you see a CT scan, it shouldn't take more than 3 seconds for you to tell whether it's epidural or subdural. Is that clear, folks? So because it stays within that section, they could only push down because dura is soft. It's easy to push. It's just a covering. We call this epidural hematoma. Okay, the disease is called epidural hematoma. Epidural hematoma. Is everybody clear, folks? That's epidural hematoma. Now, let's read about that. Now, when it comes to epidural hematoma, the blood stays within that compartment. They cannot go anywhere else. Are we clear? Let's read this. Meningeal artery, I want you to see here. There is an artery inside. It's called middle meningeal artery, like that, literally exactly like that. There is a weak space right where my finger is at now. This space is called treon, P-T-E-R-I-O-N. You see that? Treon. What is treon? Treon is a junction where all the bones meet and communicate. Frontal bone, temporal bone, parietal bone, everything meets there. Because all the bones are meeting, that is the thinnest area of the body and it's the weakest area of the body. A good punch right here on the side will break that area. When they break inside, you just have middle meningeal artery right there. Is that clear, folks? So anytime people have a fracture on the side, the rupture of middle meningeal artery is the most common one, folks, because that's a thin area. That's why if you see kickboxing people, they always wear a helmet on the side. Even if they don't cover, they always cover the side because that's a danger area, folks. Is everybody clear? All right. So that ruptures the middle meningeal artery. So the most common artery is middle meningeal. People have lucid interval. What is lucid interval? They lose consciousness, they gain consciousness. They lose, they go in and out. That's what it's called, transient loss, folks. Okay, that's that. And sometimes they get scalp hematoma. Okay, that's a different story. But here it's a CT shows biconvex lentiform, not crossing suture lines. So these are considered that suture lines. It doesn't cross. So everybody clear, folks? That's epidural hematoma. Any question in epidural hematoma?
So the lines in our diagram, those are the suture lines?
Yes. Okay, so it does not, so within that. Now the next one we're going to talk about, what happened if you rupture a bridging vein, the blood will be like this all over the place. Is everybody clear, folks? Because there is no compartment, they cannot stay in one place. It will look like this. You see that? The entire side they're running around, isn't it, folks? That's called subdural hematoma. So this is called subdural hematoma. That's called subdural hematoma. How hard is to differentiate subdural from epidural from a picture? It shouldn't be. Look at that, guys. The entire side, even here, the entire side. Because there is no suture line. They cross the suture line, they go everywhere, okay? It is a rupture of bridging vein. It could be acute or chronic. It can happen due to trauma, cerebral atrophy, increased age, different reasons, folks. Crescent-shaped hemorrhage crosses the suture line. That's subdural hematoma. Which one is danger comparing to epidural and subdural? Subdural is the silent killer, what we call, because when epidural happens, blood is arterial blood, the pressure is high, they lose consciousness faster, which means they become symptomatic faster. So when they become symptomatic, you know something is not right. Subdural hematoma is the venous blood, so they bleed slowly, and the only time it will produce symptom when the massive bleeding has already occurred. Is that clear, folks? Most of the time with the subdural hematoma, a good example, this is a true story. A pediatric kid, 4 or 5 year old, was playing in the backyard, fell on the floor, hit the head a little bit. We wake up, all good. It's very normal, right? People hit the head. There's nothing, bruise, nothing. After 2 hours of playing, the kid wants to take a nap, went to bed at 2 in the afternoon, did not wake up till 7 o'clock. And when they checked the kid, that kid was already in coma. This happened to a son of a pediatrician in my old work. That's a true story. The kid is alive and stuff, they removed. But the thing is, what I'm trying to tell, that subdural hematoma symptoms develop slowly over a longer period of time. So by the time it comes, right? That's why they say when somebody had a head injury, even if they are sleeping, you need to wake them up once in a while to check it. Is that clear, folks? All right. So that's subdural hematoma. Any questions so far?
If the person with the head injury has had a vomit or not?
That's also, you see, if they had a vomit, you can't tell they're bleeding, but that means you need to be hyper alert on people who vomit. Okay. And the best thing is to go to the ER and take a picture imaging and come back, folks. That will be more peaceful. Does that make sense, folks? I do that. Okay. It's better to take them because, if not, you have to deal with not only the kids, you have to deal with the wife too. So it's easy to take an image, be done with it. So for sure. So that's that. Okay. Now, the last one, subarachnoid hemorrhage, folks. That's a bleeding inside the subarachnoid space. So basically, your circle of Willis is rupturing. The blood is mixing with the CSF. We call xanthochromia. Xanthochromia means blood mixed with CSF. Okay. If you want to know the spelling, I don't know that either properly. It's right there. Xanthochromic. Xantho means yellow. Chromia means CSF. The blood becomes a little yellow, folks. Okay. Xanthochromic. So that's bleeding in the subarachnoid space. Now let's talk about this. Bleeding due to trauma, rupture of any of those aneurysm or anything. Patient complain of worst headache of life. Now write it down. It's a circle of Willis or cerebral arteries. First, that you should know that cerebral arteries. Okay. Worst headache of life. That's what happens in here. Worst headache of life. Now, the last thing I just wanted to give you, if you don't learn this, you will not get this question right. This area, I'm going to highlight it. What do we call this? These are called sulcus. That means a small groove. Is that clear, folks? They ask this in the exam. The only bleeding where the blood can get into this sulcus is subarachnoid hemorrhage, nothing else. Is that clear, folks? Only subarachnoid hemorrhage, the blood can go in there. Your epidural or subdural cannot get in there, folks. Is that clear? So this is so important, okay? This is the most important of this bleeding today. So the blood that, if the question says the sulcus is filled with blood, that means it's subarachnoid hemorrhage. Is everybody clear? All right. Now let's talk about complication. Let's see here. Let's say I cut my radial artery. I want to suicide myself. I cut the radial artery. I'm bleeding. What happened to my bleeding? Would it continue bleeding or the bleeding will reduce after a while? The bleeding will reduce after a while. Why? Because your body has a mechanism. If they are bleeding, they cause vasoconstriction. That vasoconstriction is to prevent losing blood. Is that clear, folks? Okay. So that's a body mechanism. That tells you if you want to suicide, don't cut that. Ask me, I'll tell you the right artery to cut it. Okay. Now, so that's normal part. Now, let's say if somebody had subarachnoid hemorrhage, which means one of the blood vessels is ruptured inside the subarachnoid space. So what the body does to prevent the blood loss, they do automatic mechanism where they do vasoconstriction of the blood vessel. Instead of constricting that one blood vessel ruptured, they constrict the entire circle of Willis. Now, when they constrict the entire circle of Willis, now the brain is not getting enough oxygen. Is that clear, folks? Because cerebral arteries are the arteries that perfuse the brain. So when that protecting mechanism is happening, actually it's making worse. Is everybody clear, folks? So we do not want that help. So whenever people bleed, it's better to bleed than trying to constrict the blood vessel to prevent the blood loss. Are we clear, folks? So whenever people have subarachnoid hemorrhage, we put them on calcium channel blocker, what we call nimodipine. Why do we put them on? Because we know there is a possibility vasospasm can occur soon. That vasospasm will cause ischemia, and actually it can cause a stroke. So we put calcium channel blocker to prevent that vasoconstriction of the smooth muscles. Everybody clear, folks? That's key. This is a famous question on the exam. They ask two types of questions. What do you do next? Give them nimodipine. That's one answer. Second, they tell you the patient was given nimodipine. They ask you why. The answer is to prevent the vasospasm that happens afterwards. So everybody clear, folks? All right. Now, increased risk of communicating hydrocephalus. We just talked about that. Is that clear, folks? All right. So that's subarachnoid hemorrhage. Any question for me? No. The last one. Now, inside the brain, folks, this is your brain inside. There are tiny blood vessels that goes inside the brain. Okay, these are tiny. We call very tiny blood vessel. In fact, we cannot even get into those blood vessels. The only thing you could do is inject a dye to see, but no scope, nothing can go, folks. No angiography or anything. Is everybody clear, folks? Now, what happens sometime when patient has a really high blood pressure, hypertension, like when the blood pressure goes more than 200 millimeters of mercury, when it's really high. These blood vessels are tiny, very tiny, weak blood vessel. They pop, they rupture. They rupture. When they rupture, there's nothing you could do. It's basically watching game. You just sit and watch. Most of the time they die, but sometimes they don't, okay? We call this intraparenchymal hemorrhage. These are intraparenchymal hemorrhage. Inside of the brain it's happening, caused by systemic hypertension. Sometimes also seen with amyloid angiopathy. That means the blood vessel is already weak. If the blood vessel is already weak and even a little high on the blood pressure will rupture it. Is that clear, folks? All right. And it's called, they have all these things. We call this hypertensive hemorrhage. Another name for it, Charcot-Bouchard microaneurysms. This, and this is all same name. So for one disease, we have 3 different names. Okay. For one disease, we have 3 different names. Don't get confused. The most common is pontine hemorrhage, which means when the blood pressure is high, your pontine branches from the basilar artery can rupture. Is that clear, folks? Not only pons, but the most common. It can happen anywhere, but the pontine hemorrhage is why I'm talking. Pontine hemorrhage is really bad because brain stem is more important to live than your brain, folks. Is everybody clear? Okay, so your brain stem is more important. When you bleed, it's happening way inside. So you're going to see somewhere in one area way inside of the brain. Not epidural, not subdural, anywhere closer to the edge. It's way inside. Is that clear, folks? All right. So that's that. Let's do some question to see if we can apply what we learned.